Okay. Good morning, everyone.
Morning.
Welcome to Managed Care, to our caregiving skills at home. Congratulations. Today is your first day learning about caregiving skills, and you have made yourself here. We'll start at 10. So before we start, appreciate you can sign on the attendance list and then put in your full name. So some empty paper for you to write down notes if you need.
Thank you.
Welcome.
Thank you.
How was the driving coming here?
Yeah, good. Not so traffic because at 10.
Past the traffic.
Yeah, past the traffic.
Yeah. All of you drive?
Yeah. No drive. Today traffic was actually so much better. Normally there's always this jam around the Bangsa LRT. Just a little bit of a stretch. Today there was clear. So.
That's good. Yeah, because it's also at the middle of the week, not
Yeah.
Monday.
Yeah.
Okay. Thank you. Okay. So before we start, get yourself comfortable. All right? And then let's introduce to each other to know each other better. Tell me your name, tell each other your name, and then why are you here? Second, in your life, what do you fear the most? Name two things. Okay. Question number 3, when you are old, you want to retire, where do you want to live? You can say different country. Is it in the house, in a nursing home, with your friends, with your spouse? So you have 2 minutes. Is that enough to prepare?
Yeah.
Yeah, you can start thinking about your answers now.
Name? Fear the most.
Yeah.
2 things.
Yeah.
I feel like that's a lot.
Easier for you then.
You can prepare first. Done? Who wants to start first?
Okay, I'll start.
All right.
Okay. So my name is Anis.
Anis. Hi, Anis.
Hi.
Hi, Anis.
So why am I here? I'm here because I want to improve my ability to take care of people skillfully and with the correct and proper techniques to avoid my own injury, to avoid the injury of my patient, and to be most efficient. Okay, so the 2 things that I fear most in life, in the context of caregiving, what I fear most is that someone gets injured or hurt because of my lack of skill. And secondly, I guess that if I had ever come across the need to take care of my parents, my biggest fear is that I'm not able to do so. So where do I want to live when I'm old? Where do I want to live when I'm old? Ideally Italy. No, but most importantly, I hope that I can live independently to old age.
Yeah, that's very
Independently.
important.
Yeah. Okay. Nice to meet everyone.
Thank you, Anis.
Thank you.
Okay, do I sit?
Okay? It's okay. It's okay.
Okay, hi everyone. My name is Shahrul.
Shahrul.
I come from Kelang. Okay, what I'm here today is I want to learn about caregiving because I don't have any experience, doesn't have any skills to what is caregiver, and right now I'm live with my parents, so that's why I am taking care of my parents. That's why I came here to learn the skills, the right skills lah. And then the thing that I feel most is I fear about loss of the people that I love because because I'm sitting with my parents and I fear of the loved one, especially my parents lah, because that's why I want to learn about caregiving so I can help them before they go leaving me. So yeah, that's what. Where do I want to live is I want to live at my house lah right now in Kelang because I am comfortable with at that area. I really know well known about the area where's the
Familiar with the place.
familiar with the places. Okay, that's all.
Thank you, Cheryl.
Okay, hi, my name is Sasha.
Hi, Sasha.
So I'm currently a marketing manager of a nursing home.
Oh,
Okay,
welcome.
yeah. So thank you. But the thing is, I don't come from the nursing or medical background or anything like that. I don't have that skill set. So even though in the marketing sense, you're not really always hands-on with somebody, but it is good to know. And
Yes.
because then it is also you'll be able to realize what you need to apply back, where you're working, and also how you can raise the awareness for the public and people around you that this is something we actually need to know before it's too late, kind of thing.
Correct.
So how to bring that awareness and make people sort of get on this a lot earlier lah. Okay, so that's why I'm here today. And in my life, the two things that I fear the most, okay, one I think is quite similar. I think we all might be here for the same reason, which is like when something happens to someone you love, regardless of age, from young to old, or even pets or anything like that. It is mostly that one that when they do call you for an emergency, that you don't really know the right thing to do,
Correct.
and you might be in a state of panic. This is what I should do first and all that, but all that time that you spend doing that may not be the right moves. So what to do first, what to do later, that's important. Second thing I fear is the dark. I'm just afraid of the dark. Yeah.
Okay.
Yeah. And
Thank you for being
as
honest.
as a full-grown adult, I still sleep in the night light because I'm scared of the dark.
Oh,
Yes.
so you're on light every night.
Yeah. And then last time power cut, the small light go off, so now I have the rechargeable
battery.
battery.
Oh.
Yeah, on solar.
Yeah. Yes,
Good to
so
know.
yeah. And where do I want to live when I'm old? Here, actually, I really like it back here with all the people that I love. It's nice to travel and come back and all that. I want to still be young and I want to be fit enough to travel when I'm old. But as I age, I want to be around the people that I love, be around the food that I like, and
Malaysia food.
yeah, Malaysian food. I want to preferably be in my own house and be able to take care of myself, know the help I need to call when I need it, and I want to have my pets with me. So that's it.
Pets.
Yes.
How many pets you have?
I have 5.
Wow.
3 cats and 2 dogs.
Okay.
Yeah. 3 cats, 2 dogs.
3 cats, 2
Didn't
dogs.
quarrel between them?
No, they get
Cats
along.
and dog?
They get along very well.
Okay,
Yeah,
that's good.
multiracial also. Yeah, so yeah, that's it for me. Thank you.
Thank you,
Okay,
Sasha.
thank you, Sasha.
You want to live when you are old?
Yeah, that's at home. With them, with my pets here in Malaysia.
Yeah.
Okay, hi everyone. My name is
Hi.
Atika. I'm a
Atika.
volunteer for NGO as a caregiver.
Oh,
And
so
I meet-
meaningful.
Sorry?
Very meaningful. Yeah.
Yeah, also because I always deal with homeless people, with the food contribution, so I need to know more about formal caregiving, learning how the process is all about. And in my life, I fear snakes
Oh.
and losing someone that I love. I think technically we have the same thing here. So yeah, I want to try to overcome at least the fear of losing someone that you love. So when I'm old, I wish to live at my own comfortable place where I can call my own home. But I don't want to be alone.
Mm.
So that's
Yeah.
it.
Thank you, Sasha. Thank you, Atika. Yes. So Atika, Sasha, Sharul, and Anis. Thank you for sharing. So to address some of your concern, in terms of what you worry, is when someone needs care, how to react. Over here, this is a first class for basic foundation to learn the skill as a caregiver. So subsequently, we have a series of workshops that you can come, which include advanced class and then the first aid and what to do when there is a fall at home, how to take the vital signs, how to manage medication. So we have a lot of workshops every month that you can check in our website. So I hope all this will benefit you moving forward.
Okay.
Yeah.
That's good.
Yeah. So now let's do energizer.
What is it?
I will explain to you. So basically, it's an activity to energize you all. So can I have everyone to stand up and line up in a straight line here?
Okay.
Facing to the whiteboard, so like this. So Sharul, you can be the first one. Okay, Anis. Okay, you can face the whiteboard. You can face the whiteboard. And you're at the back of Sharul, each other. Okay. Okay. And Sharul, Anis, Atika, look in front. Sasha, turn to me. Okay.
Is it kind
Okay. Watch this, hold, and don't show to anyone. Hold this with you. Hold this with you. And okay, Sharul, you don't need. Okay. Ready?
Yeah.
Okay. Basically, you have for Atika, Anis, and Sharul, behind you, the person behind you will draw something on your back. And then you need to translate it to the next person in front of you. While so we have pen. You can take your pen if you want to. I have pen here as well. And then Sharul, you have to draw on the board. All right. I'll explain why later.
Okay. Is Sasha going to start off?
Yes, Sasha will start off.
So what you have to do again, just draw.
Okay. So you put on the back of Atika,
Okay.
and then you draw.
Okay. Let's memorize this.
Yes. 5 more seconds.
Okay.
Okay. All right. You can start now. So now Sasha is drawing on Atika's back.
Can I start again?
Cannot feel.
Cannot feel.
Cannot feel. Still cannot feel.
Slightly softer.
Slightly softer.
Oh, you use the back of the pen.
Ah,
That's the back.
so you cannot see. Okay.
Better. Oh no.
Okay. All right.
Can you get it?
That's all. Yeah.
That's all.
I have no idea.
Because I drew it two different sides. I drew it two different sides.
According to myself.
Okay, you can draw one more time.
Okay, I draw one side, Ma.
Think
Wanna
without
draw it straight on your
yeah,
back?
yeah, straight on the
And then draw
back.
it straight on your back, okay?
Okay.
Yeah,
alright,
straight on the back.
Okay. Okay.
Done. Okay. So now you can draw on top of her using your finger.
It's easier with this.
Can you use the paper?
That's what.
I cannot feel anything.
That's why I use finger.
Okay, wait. Can feel now? Macam Fila, tapi geli.
No, I can't feel it.
Kan?
Okay lah, just commit.
Tekak.
Tekak.
Yes.
Okay, sini lah. Kita ni berapa? Tak tahulah. Macam ni. That's it.
Okay. Are you taking this too?
Not sure yet.
Breathing exercises, okay.
Is it?
Yes.
That's it.
I get it. Is it what?
You sure? Done?
Do you have any clue? I think it's yeah.
Okay.
Yeah, is it?
Okay. So the answer is this one. Almost there.
Just the smile and the round.
This one also.
This one also.
Okay, not bad, not bad. At least the shape is there. Thank you, everyone. You can have your seat.
Yes, that's what I do. Then the pen koyak dalam meeting.
So why am I doing this? It's because we are going to learn about how to support and assist your team members, which is the person that you are care for. And then at the same time, while caring with the right skills, you have to communicate as well. This is what we'll be learning today. Because during the process, you will support each other, like Ani supporting you again by circling 2 more years. Yeah, and then the communication skills we have. Right? So I know you're already. Now I'll explain to you about myself. My name is Ho Man Ing. You can call me Man Ing. My background is a registered nurse, and I've worked in Singapore before as an emergency nurse. So then after about 3 years, I came back in Malaysia to work in a community as a care manager. After that, I progressed as an assessor, then towards as a trainer, and now I'm a resource management manager with managed care. So basically also I'm conducting training to teach you how to care for a person. Yeah, I'm also a HRD Corp certified trainer.
Oh.
You can call me Man Ing.
Hi.
So today we will be learning about how to be a skillful caregiver. So then after the end of each module, you will be demonstrate to me after I have teach you what are the skills. So I want to make sure that everyone is capable of doing the right skills. Okay. Right. So we have 3 topics today. The first one is the role of a caregiver. Sharo, can you read what is the learning outcome of a role as a caregiver?
Able to list the role of a caregiver.
Yes. And what is the purpose of it?
The purpose of it, provide supports and assistance to individuals who need help due to old age, illness, disability or other factors.
Yes. So thank you, Sharo. This is basically to address why you are here today. The right skills for you to care for a person. So number 2 module, it will be on effective communication. How do you communicate with the person that you are caring for and also your team members if it's happened one day you're working together as a team. So then what is the learning outcome, Sasha, please?
Learning outcome, able to implement effective communication methods with patients at home.
And the purpose of it?
To build strong work relationships with co-workers, patients and patients' family.
Yeah, so we have a good communication, we have a good rapport between everyone. And third one, what is the module 3 we are learning on is our hand hygiene skills. And Atika, can you read out the learning outcome?
Able to apply hand hygiene techniques efficiently.
Yes, and the purpose?
Crucial to maintain health, prevent the spread of infections, and prevent contamination of patients and environment.
Yes, thank you, Atika. While caring for someone you love, it is important to prevent infection as well. Yeah. So overall today, by learning module 1, 2, and 3, you all will be able to perform as a skillful caregiver. Yeah. Okay. So now I'm going to draw a roadmap. This is a road example for you. Alright, based on the 3 modules that I've explained, which one you think is the most important? And then which one is the least important? You all can come out and write 1, 2, 3, which one you think it is more important and least important for you. Yeah. You can draw on the board. You can come up.
Sorry.
So you can write on the roadmap. This is your road career path. Which one you think is more important and least important for you to learn about? Module 1, 2, and 3.
Based on our own.
Your judgment of which one you think is more important for your current condition now. You can just write 1, 2, 3, which one is it?
Keep the first one.
Number 2 and 3? So as you go higher, the importance gets more important. So that is your rating. For example,
the
yeah,
importance.
yeah, yeah. Okay. Thank you, Atika.
Okay, sorry.
It's okay. We go step by step.
So here is most important. Is
Yes.
Right?
Mm.
Can I go on the road?
Can.
Okay. Yeah. Yes.
2. Okay.
Mine is actually like you. I just hilang.
Yeah.
Terbalik already. Okay.
Sweets here. You all can have it. Wow, Shara, everything is important. Very good. Thank you, everyone. So now I can see number 1, the role is the most important, and then number 3 and number 2. Good. Next. Okay, role play. We have water here, and we have jug of water here. I want, this is group A, this is group B. So you are in a group now since it's a separate table. Pretend one of you to be one is as a caregiver, another person is a elderly. And this elderly, he is very weak. The both hands only like mild energy, which is 10% energy strength left. But he wanted to pick up the water and pour. Sorry. So while you are attending to this elderly, how do you react? You can react based on what you think that is the right move. Yeah. Then you want to discuss who take up what role first and what to react. Then before we start, we have 1 minute or 2 minutes of discussion.
I'll be the elderly.
So Anis will be the elderly. You are a caregiver.
Okay.
Okay. Then you think, as a caregiver, how do you want to react to this? Perhaps this one you move aside first. And yeah.
Okay.
And 10%.
Easy to
Energy you need.
10% energy.
Mm.
Yeah. Okay.
Okay. Tell me when you're ready.
Okay.
You're ready.
Okay.
Okay.
Yeah.
Ready?
Ready.
Okay.
Just do the normal.
Okay, we can start now. So pretend.
Let me help.
Let me help you. Sit comfortably first. I'll help you. Sit first, comfortably. Okay. Hold for you. Oops. Okay. Give you drink a little bit at a time first, okay? Can you hold the glass?
Okay. Very good. Okay.
Help you.
Yeah, done.
Okay.
Okay.
Good.
Have you?
All right.
Drink.
Okay.
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 And take the glass
Okay.
back. Okay. Is that enough water?
Okay. So I observed there are two different ways of respond here. No right or wrong. One, Shahrul, can you explain first how do you respond to elderly Anis?
When I see, yeah, because elderly is not have so much power to
Lift up.
lift up the water, and then I help her to pour the water, and then help
By
her also.
supporting the base,
Yeah.
right? Yeah. And then,
Then
yeah.
Can do it again if you want.
Mm.
Just supporting
Okay.
because she is not so. Then I help pour.
Okay.
Until nearly most to the full of the cup, because if too full, I thought it will be shaking and then tumpah already. Then I also help her to drink. Support.
Okay.
Yes.
Okay.
And
All right. Thank you. Group B. Group A?
Yes. Yeah, I saw her reaching for thing first.
I was like
So I saw her
that.
position. She may not be in like a comfortable position to drink. Speaking from experience, I can spill on myself. So I get her to sit in a comfortable position first, where she's calm and easy. I pour for her away because I'm not sure. Sometimes if the hands, she might reach too fast or too slow. Then I bring the glass to her, and I help her hold the glass to drink.
Okay.
And just say if you want some more, I can top up. If not, then I put back and I put it further away.
Okay. Thank you, Group A. So there are different ways, and we can do different ways. But the logic behind is we are there to provide support like Shahrul providing support and assistance based on the condition of the elderly. Example, in the scenario that if you are meeting this patient for the first time and you do not, like you say, you don't know how she will react, is it too fast or too slow, you can observe first and then you do it for her for the first time. But if you know how it's the condition of the patient already, you should not be taking over the task. Despite that she can only do 10%, she can hold, but definitely cannot hold the whole jug above. So you support at the bottom. That should be the way in supporting. So as a caregiver, we should not be taking over the role of the elderly, because then they will not be functioning as much as they can, and soon their condition will deteriorate. Then they will stop doing it. Because if you keep activating, increase the function, or it will still remain lah. If you stop using it, then the brain is receiving the signal that I'm not using this muscle. So it's slowly even left with 5% or 1% of energy.
So it's good to give them hold the jug
Yes.
to,
Yeah.
to stimulate their muscle.
Yes. As much as they can do, maximize that. We are there to support, not to take over. Clear?
Yeah.
Okay. Now we are moving to module 1, which is also about activities of daily living. We call it, you will always hear about this abbreviation, ADL. So for ADL, how do you know what is ADL? Basically, you just recap what you do every morning. You wake up, what is the first thing you do?
Wake up from bed.
You wake up from your bed.
Physically move your
Yes.
body to the toilet.
So for this, it's easy for us, but it's not easy for some elderly. And then next is brush teeth, shower, grooming, toileting, and then put on clothes and comb your hair. Then breakfast, our basic needs. All this by now when they are aged, they require help. That's how we need to come in to support them. Okay. So a very simple thing that we do every day is to brush teeth, correct? To brush teeth, we need to brush. How do you usually brush your teeth? Circular motion. Just like that. You circular, up and down. Okay. So it is encouraged to brush circular because you can brush off the gum and promote blood circulation, and any food debris stay between the gum and the teeth. Then 10 times each. If elderly who can go toilet and do it at the basin and spit out, that is good. Then we encourage them to do it every day. And if they have loose stool, macam this one, example, no teeth already, do we still have to brush the empty gum?
Yep.
No, yes. So we need to, because the food may still stay on the hole, and then will cause infection. And also while we are brushing, it will promote blood circulation. Okay, so this one for you all to practice later if you
Very
want.
big mouth.
Okay.
Take out the teeth.
You cannot take out this one. It's just a model.
So cute.
Yeah. Then for people who cannot walk to the toilet, we can do it on the bed. Example, if a person is on the bed, we can use this. It's called oral swab. You can either buy this sponge with a stick from the pharmacy, or you can DIY your own. By putting, depends on the gap that you have, you want to reach. This is a cotton and this is a gauze. But make sure you need to secure. Otherwise, it will dislodge and choke the patient. So these are some of the DIY examples that you can save some cost for the patient lah. Yeah. So as you can see, there are ridges, different shapes. Here also ridges, where you can reach the interdental space, which is in between the teeth. There are space. Sometimes the food stuck there, so you can reach out there. Then you do the same circular motion. If you want to reach to the back or the tongue or the palate, then you can use a smaller one to reach. Again, make sure you really twist it tight so it don't dislodge and cause choking to the patient.
But this is not to like soak up but this was to soak up.
You can, yeah. So two functions. Cleaning with, usually we use toothpaste. Very good question, Anis. Anis was asking, is this used to soak up any, for example, solution, antiseptic solution, like chlorhexidine? We do use, instead of using toothpaste, because toothpaste you have to spit out, but they can't. So instead we use those like antiseptic chlorhexidine gargle. Then, but you dry it, you squeeze it a little, then you clean the oral. So they don't have to spit out the bubble from the toothpaste. It also prevents infection. Okay. So the first photo is an example of a plaque, meaning if not effectively remove the food debris on the teeth, it will be deposited here. The second photo is a sign of infection or inflammation. It's inflamed, it's swollen, and it's bleeding. Okay, what is that? Dentures. Who handled dentures before?
Never.
Not yet.
Not yet.
Okay, not yet. Soon. So there are skills to care for these dentures. Basically, before I start, let me share a story, a real case that I have. So I used to assess elderly at home. So there's one time when I was as a care manager, I received call from the elderly's daughter. She said that her father is not eating for 5 days, refused to eat, and getting weaker lah, for sure. So then, of course, I went in to assess the father's condition. So check, not much medical problem. Then we sit down and chit chat with the father. Then we went home. Second day, I went there again to assess the uncle, and then I found out that while he's taking out his denture, it's actually shrink a little. Okay, and he said that he has ulcer. So then upon checking, there are 3 ulcers which cause pain because of the dentures scraping on the gum. Hence, he has no appetite and refused to eat. Immediately, we send to the dentist and get the dentures fixed. Once it's fixed, he putting it back, adaptation 1 or 2 days, he resumed his eating habit. Problem solved. So some of the habits of elderly, they will use the dentures and use a tissue paper wrap and then put at the side of the table until the next day, or especially when they are in a hospital or a nursing home, they can't get help to get water to soak. So with this, the shape of the dentures dries up, change. So it did not fit appropriate according to the gum, hence causing scraping and ulcer, then infection. Then they stop eating all. Because
the dentures can shrinking because
yes, it should be soaked all the time in the water, at least 6 to 8 hours.
every day.
It should not be putting here and air dry lah.
Okay.
Okay, so then as usual, we brush our teeth every day. Dentures, the same. We have to brush the dentures every day. So if you assist in taking care of an elderly with dentures, you have to encourage them to brush it every day, at least once a day. Okay, so over here, clean your dentures at least once a day. And then while you're cleaning, observe for any loose stools that are going to come out or any distorted shape. Then after that, observe for any, you ask the uncle, do you have any pain? And then you check any swelling or redness on the gum. If there is, then encourage to go see a dentist. Next, then as I said, do not wrap the dentures, but you soak in the water for 6 to 8 hours, especially when at night they are not using it. Can be using warm water or any now outside a lot of pharmacy are selling the tablets, dissolving tablets as anti-dissolve, for disinfectant infection purposes. That is good as well. So this is one of the encouragement that we can encourage the elderly to promote their eating habit. Then make sure they gargle their mouth before and after, before putting it back and after removal. If after removal they do not have teeth, do they still have to brush their teeth?
The gums.
Gums, yes. Yeah. So they have to brush their gums to prevent any infection as well. So far, any questions? No. Okay. Anyone knows what is this?
What's that? What is there in that?
Portable potty.
Sorry.
Okay. This is this. It is a portable potty. It's called commode chair.
Commode chair.
Yeah, so then you can bring to the toilet. You can place this in the toilet or next to the elderly's, the patient's bed. In case at night they always need to pee,
Oh.
then you can remove this, and then remove this. There's this pail under. They can
That's why
sit
got
on top.
pool there.
Yeah, it's a sort of
okay.
portable
So it's easy to, rather than bring our elderly to the
toilet
we put the toilet next to.
and next to the bedside. Yeah. So for them to pass urine, pass motion, done already. You cover, then wash in the toilet. Or you can remove just the pail at the bottom here.
Yes.
Yeah.
Oh.
Then you can put it back, just slide it back. Yeah, like that. Okay. Another way is you can leave this in the toilet because by removing the pail, you put this at the toilet under the rain shower. So then you can shower them while they are sitting because this is plastic and it's steady.
Multi-purpose lah this one.
Correct.
Not only for.
Yeah, sorry. Okay, this one. So at the bottom, we have the anti-slip base, and also you can adjust the height.
Nice.
I'm gonna put it here. Later tea break time, you all can have a look.
Okay.
Yeah.
Good tools.
Yes, it is to ease our toileting process.
Okay.
It's called Como chair. Next, what is this?
To wash your hair
Wash your hair.
or brush your. It's like basically a portable sink that you can take to the bed, right? To the
Yes.
chair, to the bed.
Looks like pool.
Looks like a swimming pool. It's a swimming pool for the hair.
Oh.
It's a portable hair basin. So basically, example just now, if the elderly can walk to the toilet or can slowly move to toilet, we shower them using this at the toilet while they're sitting. If they really cannot, then we can wash their hair on the bed. This is one of the example where the head will slide between this space, and then you can wash. The water will accumulate down here. And then this part, this thing is to support the head so it don't tilt behind. Then you rinse the shampoo and the water and wash the hair. Okay?
Okay.
So there are a lot of gadgets out there to help as a caregiver. Yeah. Next, we are moving on to eye care, which is very important because it's commonly easily get infected. What is the purpose of carrying an eye?
So doesn't like reduces cataract and does that help in any way? Discomfort.
For comfort,
Yeah.
yes. Yeah.
Prevent infections.
To prevent infections, cleanliness to maintain clean and comfortable. So another one is, all of you are correct. And one more is, before we put medication, we have to clean it first. Otherwise, then the dirt also go in. So how do we clean our eyes? Wash. How do you wash?
Just take tap water and then just rub there.
How do you rub? In what direction?
Circle and then
Like that.
left to right like that.
Left to right.
For me, if for myself I will do that. If for elderly, I don't think that will be good
For
lah
women
because
also no.
maybe it will hurt them because too hard or too
Rough.
Yeah.
Okay. Thank you, Cheryl. What about Anis?
I either use a washcloth or I just use my hands, but I wouldn't rub aggressively because I'm scared of wrinkles.
Oh yeah.
So I just probably in an outward motion.
Okay, that's one of the way. This one is like that. This one is like that. What about Sasha? How do you clean your eyes?
She used the Besides eye drops, there's the cup thing that's sort of like
Ah.
stick. I use that.
That is good as well.
So I just sort of
Mm.
like tip back. And,
The solution comes with a
Yeah,
cup,
in the
and
cup
you
one.
do like that, right?
Yeah, so that's what.
That feels very comfortable each time you do it.
It feels like you're getting a new set of eyeballs. It's fantastic. If you do one, you don't do the other one, you feel a very obvious difference.
Correct.
Very obvious
Yes.
difference.
One is more clearer, right?
Yeah, and it's like not so dry lah.
Yeah, that is good.
Mm.
Can do that. Atika?
Either by using direct water,
Uh-huh.
splash it, or take a cotton pad, just rub it.
Like that?
Yeah, like that.
Okay.
Outward also.
Okay, outward.
Yeah.
Most of you get it right, which is, okay, here.
Okay.
We need to do it from in to out. In to out. For elderly, use a gauze or cotton. Slowly, you can put some normal saline or some warm water. Then just dab, put there, out. Then don't repeat the same surface on the eye anymore. You can fold it or you can use another new one. Use cotton is more economic, or cloth, washcloth. Reason being is we have duct here. This is very prone for infection because it will get stuck, and then accumulation of the bacteria, then infection will set in. So usually you sometimes, depending on severity of the infection, you need to bring to see the ophthalmologist to flush out the debris or the germs, which we do not want that. So just maintain wiping from in to out from here, then in to out from here, then change another one. Again, if Shahrukh? This one. Bed bath. A person who cannot go to toilet and sit on the chair for shower, we will do bed bath, bathing on the bed. So we have another workshop. It will take at least 4 hours for you to learn every step of it. Bed bath. And then at the same time, change the clothing and also the bed sheets of the elderly while you are doing the bed bath. So one process, 3 things done. Toileting. There are different ways an elderly can go to pass motion or pass urine. This one is one of it. You can put at the bedside for them to pass out and then go back to bed. Another way can use urinal, which they can, if they can stand, then they can put and then they can urinate. Another one is bedpan, which I can show you here. This is a bedpan. Basically, if a patient is on the bed, you just slide it, lift their buttock up, slide it under, then they can pass. But a lot of feedbacks from the elderly, they don't feel comfortable doing this on the bed. Correct.
Will be splash out.
Yeah, so sometimes when they are on it, then you can put a tissue on top here first. So if any splashes, it will kena the cloth, the tissue. We have so many gadgets. Yep. Otherwise, this is not really encouraged, but when really no choice, we have to use that. Okay, question. I'm sure you have seen this before.
Okay.
What is this? What is the purpose of this?
To bring to one point to one point.
From
From one point to one point.
from one point to the
If
other
the
point.
elderly cannot walk, just put there, and then we tolak.
Tolak, we push. Any other opinion?
Mini transport.
Mini transport. Okay, luckily all of you are at the right track. This is not for a person to sit for long term. This wheelchair is still fine. Some of the wheelchairs, the material is like plasticky. It's very hot, so it will cause the skin breakdown of the elderly if they are sitting for too long. They should not be sitting for too long, but they should be used for transportation only. So it's for transportation or transfer.
What's the longest? I mean, not, but you do see sometimes in homes and things like that. They are seated for a very long time.
Or for
On a
example, you're
wheelchair
taking someone
to the hospital.
So what's the threshold? Like
Yeah.
how long is it advisable for them to be on a wheelchair before you should just pick them up, maybe let them...
This depends on the condition of the elderly. Example, what are the medical conditions they have? And their skin condition especially. And any existing skin problem they have. If they already have a bed sore, a pressure sore, then it should be as soon as possible, then you remove. Okay, but I do understand hospital is very, you have to walk very far and the waiting time is very long.
Yeah.
Perhaps can try getting a different types of wheelchair with a better support. Once you go to the pharmacy, then they will have a lot of different types. And then back to your question, medical condition. Do they have diabetes? Because diabetes will affect the skin, skin healing and also the blood circulation and also any heart problem. So if especially diabetics or existing skin problem, then they are higher risk. So they want shorter time. Case by case, if you know this person about half an hour or be already redness, then we should keep at that time frame already. So you have to know your patient very well, understand their condition, and observe any redness of the skin. Geriatric chair is one of the encouraged chair that is suitable for elderly. These are some of the examples. There are different heights, different width, so you can go to the pharmacy and try again. See which one fits better. Okay. Let me just share with you some of the handouts. This one. It's important for you to recognize this. One. Yeah. Yeah.
Thank you.
We call, as you can see, the red dots are pressure point. When the person is lying flat versus lying sideways, sitting slanting, and also on a wheelchair. Those red dots are the areas that is prone, very high risk for pressure sore. That's why choosing the right bed, choosing the right chair, choosing the right wheelchair is very, very important to fit the size of the person. Otherwise, it would be pressing on the bony prominences, especially the hip area, the sacrum here, the shoulder blades is very high risk.
Like the air mattress helps as well, right?
Yes, air mattress is one of it if a person is lying on a bed for long term.
How does it affect the heel? Yeah? Because normally this is common, but the
Heel.
heel, I cannot picture.
Okay, if you are laying down for very, very long time, this will happen more than weeks.
If the feet is like,
Feet, because
foot is like that, right?
your feet,
And the heel is
your feet.
straight.
Example, this is your feet. This is the bed, so you are resting on it. No blood circulation. Yeah,
correct.
then it will start developing as well, pressure sore. Hence, when we are lying sideways, we need to support all these bony prominences by putting pillows. Then we have to turn them every 2 hourly to promote the blood circulation. Okay. So far, any questions? No?
Oh, good.
All good?
All good.
Okay. Let's
But
move.
I have a question.
Yes.
Okay, besides 2 hourly turning and the mattress, support pillows, are there any other means to prevent bed sores?
First is the nutrition of that person. If you have a good nutrition, then your blood is healthy. then it can supply to the needs of your body. Number 2, keep moisturizing the skin but not wet. Moisturizing the skin in terms of applying some lotions, moisturizer without alcohol or fragrance.
Right.
And then you can do gentle circular massage but not hard. And then it's very crucial for you to, while you're doing all this, observe the skin color. The very first sign is redness. That is the fastest developing, but very fast you can reverse it. So usually in 2 hours, if notice already, in 2 hours, I reposition it, do what I need to do, change the pampers if it's here, maintain dry. In 2 hours, it's gone. Yeah. And if it's the room is hot, then consider turning on fan, aircon, but not too cold. Alright, let's go move on to our case study. Now that you have learned the skills as a caregiver, this is a case for you to discuss in your group. Can I have Sasha to read the case?
Madam A is a 79-year-old lady staying alone at home. You visited her for the first time at her home, and below is your observation. She is bedridden but have mild strength on both upper limbs. She has not showered in 5 days. She has a pair of dentures on the side of her table. In 10 minutes in your group, list out what you can do for her.
Can? Thank you, Sasha. Can we start?
Yeah.
Okay, come. Mild strength on both upper limbs.
The dentures also on the side. And she has not showered in 5 days. So, this is not in order, right? It's just the things that we need to do.
When we
isn't it?
visit her.
Yeah.
Okay, it's not-
As a caregiver.
Okay.
So there are 3 conditions there.
I guess need to see lah dia ada check ke dia tak tahu macam mana nak move her and lift her up from the bed. Mild strength, whether she just needs assistance to move up and she can stretch herself up. She's got mild strength, you lift those so she's good again. So just to see her gauge her movement, if she can move and she just needed assistance, maybe she needs to go. If she can go to the shower, we can take her.
Yeah.
If she can't, then get shower.
That's all taking.
She says she's okay with the lower lips and she probably stands for so she's not
And then she's on the financial assist, and then the dentures. She's also on the side of the table, so have to clean it, put it in the brush it.
ensure
The fit, the cleanliness and all.
Sebab bagi dia
Actually, number one, kan, I think everything I asked her, she wants water.
I
Okay.
see kejut now.
Yeah.
Okay, her tengok dia punya condition lah. Actually number one.
sekali
Assess condition.
Condition.
Kita kan straight away nak give water.
That's why assess first lah, assess.
Yeah.
Assess
See what
first.
she needs.
See, she hydrates.
Because my logic, she may not have water. Because if she had water, she would have soaked her dentures. Correct, right? Or maybe she didn't have water in class. If not, she would have soaked her dentures. But no lah, then we see to that, we assess everything, move her, to help move her.
Yeah.
And then,
And then help strength assistance to move
Get her
to
dress
the
straight. Then check the condition of her dentures, clean it, see if it's fit,
Okay. Then
brush her teeth.
brush teeth, all of the, This is what they will do.
Ready? Yeah, that's good.
Take the dentist on, feed her lah.
Then I mean, maybe don't need to put her back in bed. Maybe she wanna be on a chair.
Just transfer in the car.
Can.
Just take him
So
out.
transfer ma. Sit on a chair. Sit on a wheelchair.
Transfer into the car. And just take around.
And you have to buckle lah. You know, it's like.
Nice it. Next stimulation.
Yeah, and then like she's alone at home. Like she have family. Maybe
It's
you can
easier
comfort them.
for me to take him to the car alone.
Yes.
Push him out.
That's
There's
what
no
we're
need
doing.
No, this is staying alone doesn't mean she tak ada orang kan. So like you want me to contact somebody for you. You know you want.
Dia tak boleh masuk hospital kerajaan sebab kata tak boleh. Laki macam tu.
Maybe she has a cat or a dog that needs to be fed, plants that need to be watered. This is it's true.
It's just true, yeah.
Yes, there's the extra work of a
But
caregiver.
yeah lah, if she's bedridden, she's alone, check on everything and then like.
She has no snake.
No, as long as there are lights.
As long as there's lights. Yeah. No, it's Mannings. Who can have it? But it's stuck.
Can.
It's stuck. We'll shake it. No shake it.
Oh, shake it first.
Oh.
Yeah, sugar.
Ready, Dee? Okay, good.
And if she's not in a good condition, then we have to take her to clinic or hospital or something. She's good, then we can check.
Before that, we check if she needs to be referred to clinic kan. So this is number 7 lah. 6. Doctors.
After that, doctor will just there must be a follow-up, right? That should be bedridden for another 5 days. I'm seeing this whole process through.
That's good.
No, because after that, you're done, you help her, then what's going to happen after that?
Bedridden so cannot stand.
Then you call, sorry, what company were you from again?
Managed care.
Then you call managed care and you organize for home care services.
Contact customer service.
Contact customer service at managed care. Yeah, that sounds great. Would you like some water? Okay.
3 minutes left.
Yeah.
Boleh. So masa explain tu.
Yeah.
Socialize that is it right.
Buat tadi.
I'm sure she has to focus on what she has to do.
Yeah.
So in terms of her remote homeschooling
Cleaning
then she is
Done already. Done already? Group A,
Done.
go. Okay. Which group wants to present first?
Professor?
Okay.
Can.
Come.
Yeah.
Bring your paper and put here. Come forward. Yeah. Present. Once you're ready, put your paper up.
Both of us?
Yeah. Yes. Yeah. Okay, put on top.
Simple way lah.
Tak apa, act.
Here, right?
Okay. Stand and face.
Space there.
Hi.
are presenting this case study. Melody, who's 79 years old, lady staying alone at home. Okay, what is the observation would be she's bedridden but have mild strength on both upper limbs. That means the lower limb is okay lah. The first thing that we should look out for is to assess her condition, whether she has a wheelchair or any other tools to help her in terms of mobility.
Yeah, so after we assess the actual situation around, so she has not showered in 5 days, the dentist sitting on the table. So like Atika mentioned, she's just more of the upper limb that's weaker, and but she can walk. So just to assist her, maybe like what extent you can actually get up and move up and things like that. So once we can get her up, she should be able to walk to the bathroom, and then we can get her cleaned up, brush her teeth and wash, so wash her body, all this whole range of things.
ADL.
Yeah, the whole ADL. Yeah, and then check what her dentures, condition, things like that, to make sure that it is not, as you mentioned earlier, so that the shape is still intact, it is clean. Get her gums also brushed, and do the whole cleaning, maintenance, and that. And then, of course, because she's already been bedridden, then to see later in what situation you want to put her. So check her for sores, check her for anything, and contact
see whether she wants to eat or not, and after cleaning the dentures, maybe put it on, feed her if possible, and check if she's got any other doctor's reference, any other issues that she has,
So if she needs any medical attention,
Yes.
how we're going to attend to that, and her medication and things like that. Story
Good.
goes on from there, but I think to answer
I
your
think exactly, it's like,
Yes. Yeah.
So, is there anything else? So because she's been immobile for a few days already, so I'm sure there'll be things that she
the
wants
first
to
time we see her at home, isn't it? So this
Mm.
will be the things that we
Correct.
might
Yeah.
do for her.
That's good.
Okay.
Thank you.
Thank you. Okay, next group.
Okay, so we came up with 10 things that we want to do for her. Sorry. So, so we came up with 10 things
Wow,
that we want
10
to
things.
do for her. So I'll start with the first 5 and Cheryl will do the next 5. Okay. So first of all, we'll go into her house and assess her home. So this will give us an idea of how she's been living for the past few days, seeing the condition, and also because from our understanding is she's bedridden, but she has strength in her upper limbs. So maybe we could put a support bar over her bed, like a hanging one, so she can get herself up, things like that that could make mobility and encourage independence for her. Okay, second, the main thing is we'll check for bed sores and before we shower her, because we don't want to cause any discomfort or anything like that. And once we've showered her, we'll check for her oral hygiene. We'll check on her dentures, whether it's dry, are they clean, and maybe we change the water. Does she have any ulcers or anything in her mouth? And then the next part.
Okay, the next one is we change this bed sheet because she is pregnant for 5 days, not sure 5 days, so maybe a bit smelly, so it will not comfortable for her. And then another thing is we ask her for if she is hungry or she is thirsty, so we will add the
Feed and hydrate.
feed and hydrate. And then basic grooming ideas like nails, shower, clothing, all. Then the next is get basic medical, check for the medicine, check for the background. Maybe there's a doctor's report or anything that we can see on her condition. And then the last one, maybe we can take her to socialize. We take her to go around park or go around in the car to see the outer world. So
The outer
she
world.
not boring sitting only at home.
Get her in a better emotional.
Yeah. So
That's good.
all.
That's all. Thank you. Thank you, Sharul and Anis. Both group did very well. You have all covered the ADL skills that we need to do for this lady. So now we have come to the end of Module 1. Can you share what have we learned?
How to provide support and assistance to individuals who are not able maybe to help themselves in that time,
Yeah.
and due to age or illness or disabilities.
All right.
I learned that the role of a caregiver
The role of a caregiver,
is
yes.
different according to different patients. So I guess it's important for the caregiver to be aware of the patient, the surroundings, and whatever your patient may need.
Correct. That's good. Yeah.
I learned about tools that aid the client, aid the elderly, because I never see that before. So many tools that can help us to do the ADL. That's good. So yeah.
To ease the process.
Yeah.
Anything else?
The right way to care for the patient in a more systematic way. Done.
So as a caregiver, what is our function?
To provide support
Yeah.
and assistance to individual who need help due to age, illness, disability, or other factors.
Yes. So bear in mind, we are always there to support and assist when needed. Okay. So let's go for a tea break, and then we'll come back for tea break for about 15 minutes. Then we'll come back.
Thank you.
Thank you. Energizer now is, let's move on. Welcome back, everyone.
Thank you.
Let's move on to our energizer.
Happy birthday.
Yes, it's birthday song.
Whose birthday?
Is whose birthday today? Anyone's birthday today?
My friend's birthday.
Your friend's birthday. So wish your friends happy
I will.
birthday. Yeah. Okay, can anyone stand up now? So we get energized. Everyone, sorry, everyone stand up now. So we need to sing happy birthday song together,
Okay.
Okay.
happily. And then at the same time, follow my hand movement.
Okay.
Okay.
Alright. And then after we finish the song, we say, hand wash is the best, or hand rub is the best.
Which one?
Hand rub.
Hand rub is the best.
Hand rub is the best.
Got it.
Okay?
Nail it.
Okay. Are you ready?
Let's do it.
Okay.
Follow your
Okay.
hand.
Okay. 1, 2, 3. Happy birthday to you. Happy birthday to you. Happy birthday to you. Happy birthday to you. Hand rub is the best. Okay, thank you everyone. Thank you everyone. So this song, it relates to what we want to learn in Module 3.
Oh. Okay.
It's about hand hygiene. Our hand hygiene is very important, and it's crucial for us to know the right steps to make sure that we don't transmit the germs to the next person that you are touching or the next object that you are touching. And the steps will be the same time as you sing a happy birthday song. I will demonstrate to you later. What is hand hygiene? how many methods of hand hygiene we can do? Yeah. Atika?
2 methods.
Which one? What are the 2 methods?
Soap and water.
Use soap and water.
And rub your hand with an alcoholic-based solution.
Alcohol-based solution. Thank you. So if you use hand wash, you can use any hand soap without antibacterial function or with antibacterial function. Of course, the ones with antibacterial function will kill more microorganisms from your hands versus the one without. And also, it depends on the steps that you are using to maximize the benefit. It is important for us to maintain a good hand hygiene technique. The reason is because, Cheryl, can you read out?
Because the purpose is crucial to maintain health. Second is prevent the spread of infection, and then the last one is prevent contamination of patient environment.
Okay, thank you, Cheryl. So basically, let's say this is a common sellotape that we use in this training room. Example, if my hands are contaminated and then I put it here and I don't sanitize my hand, obviously, the next person who use it, will it be transmitted to that person?
Yeah.
Yes. And if the next person don't sanitize their hands, what can happen?
Chain reaction.
Yes.
Spreading to other person.
It can spread to other person, it can spread to the rest of the objects. Example, I've touched this, and then I touch my nose, and then I touch again, then I tap on you. Then after that, oh, I want to drink water. After that, Anis drink water as well. So it spread to you and her and whoever that touched the same object that is contaminated. Same goes when you are as a caregiver at home caring for a patient. It is very crucial to sanitize or wash your hands often to prevent the chain reaction of a transmission. Question: when do we need to wash or sanitize our hand? I don't need to always, every second, oh, joke, I sanitize, then after a while I sanitize. Usually when?
Before eat.
Before
coming
eat.
in contact with the patient.
Before
after
contacting.
coming in contact with the patient.
After holding something dirty.
After touching something dirty.
Yeah, before, after bathroom, before, after eating. You know, if you know you're touching a lot of things and you're going to, like Ali said, you know, handle somebody as well, then
Yeah.
shaking hands. I'm particular about shaking hands.
Yes, shaking
very
hands,
particular,
especially
yeah.
after COVID, it's
Yeah.
very important to sanitize your hand and try not to shake hands.
Mm-hmm.
So we have these commonly missed areas whereby everyone will miss this area even though you wash your hands. The areas highlighted in red, usually our common skill fingers. Start to think when you are conducting some tasks, which fingers you use the most. Example, when you do your ADL, you hold your pen, you come to work,
Definitely with
Yeah.
the
Thumb.
Four fingers.
thumb,
This three, yeah.
Yeah.
straight.
First four.
The first like this.
The first four.
First four.
Okay. They call these fingers, some is 4, is our skilled fingers. This is what we do our things. Yeah. But as you can see, these areas are red, meaning that we often miss it. So try to think also when you wash your hands, do you particularly scrub and rub the red areas every time? Or mostly we just like that, gao tim, done. And also in between fingers are the missed areas as well.
I didn't realize that the palm here
Yeah.
was often missed.
Correct.
To me, palms are like the first, actually when you come in contact with water and soap, that's the
That's
first
the first thing,
point.
yeah.
Yeah. This
Yeah.
area, because it's our folded area.
Mm.
Okay.
What we need to do is we need
Yeah,
to
do this.
scrub it,
Okay.
which we'll show you later. Oops, okay. Again, who need to maintain good hand hygiene technique?
Everyone.
Yes, it's everyone. Okay, that is very important. And we have the 5 moments. So just now Anis gave 2 moments, Sharo gave 1, and we actually have 5 moments of hand hygiene, meaning that these are the time when you need to perform hand hygiene. Hand hygiene means you can wash or you can use alcohol hand rub. The first moment. Can Atika, you read out what is the first moment?
Before patient contact, clean your hands when entering or before touching the patient. Protect the patient from harmful organisms carried on your hands.
Okay. Try to think when we are in the hospital, in the ward, when someone is in the room on the bed. You are coming in, the door is here. Knock, knock. What is located next to the door?
Hand sanitizer.
A sanitizer. That is the purpose for moment 1. So we need to, the doctors, the nurses, whoever that before enter, because we are coming from outside, we cannot guarantee we are clean. So, but it's not visibly dirty. If it's visibly dirty, then you wash your hands. Otherwise, you just with soap for sure. Otherwise, hand rub. Then only you come in to approach the person that you are visiting. Okay, moment 2. Anis, can you read out?
Before clean or aseptic procedure. Before starting a procedure to protect the patient against harmful organisms.
Okay, thank you. So example, this is a hospital food. Back to the scenario in the hospital ward. I came in, sanitize my hand. Then I prepare, it's your lunchtime. So I prepare drinks, and then this is a tray of food, hospital food. I've put it on the table, and perhaps I need to feed or assist with feeding. So I've touched this. Remember just now I mentioned this? The tray perhaps is not clean, so we need to again sanitize. Now think, where is a sanitizer you usually see in a hospital room?
Right.
The foot of the bed.
Yes, that is the reason why they are putting that. So you can just walk to the foot of the bed, sanitize your hand, and then start doing the procedure. Procedure can be feeding, can be changing pampers, changing clothes, wound dressing, any procedure you want to do. That is before. Clear so far?
Clear.
Yeah. Moment 3, Shahrul, can you read out?
After body fluid exposure risk. After an exposure risk to body fluid such as blood, urine, vomitus, stool, and etc. After glove removal.
Okay. So here are 2 points. One is just now I have fed you, or I have changed a diaper. Of course, then we need to sanitize. Sometimes we do need to wear glove. Example, wound dressing. I put on glove. Done already, I remove glove. The glove is sterile, clean, right? The glove outside is dirty, so I throw it. But my hands still have to sanitize. I have changed pampers. Maybe I have wear glove before that. After done, I throw the glove. With glove, without glove, we have to sanitize, because we don't want to transmit any possible microorganism from the procedure to outside the environment of the patient. Moment 4, Sasha, please.
After patient contact, protect yourself and the healthcare environment of harmful organisms.
Okay. Shake hands after you have example, I've done all the procedure. Need to put the tray away after feeding. After change pampers, I put on blanket for you. And then perhaps maybe you want glasses. I pass the glasses to you. After all this contact, I have to sanitize again. Before we move out. Lastly, moment 5 is after contact with the patient surrounding. Example, I'm leaving. You want this table next to your bed, the side table, you want to take out some of your clothes. I want to close the door handle. The door handle always is very contaminated. Then when you are leaving, before going to another person, sanitize. This example is in a hospital, but it is the same when you are at patient's home. Treat the patient's room as a hospital room. Then imagine the scenario and sanitize. If the family do not have, encourage them to buy sanitizer and explain the reason why. To prevent infection, contamination.
Or should we always ourselves have a sanitizer?
Can, yeah.
On standby?
I do always carry gloves with me, and also sanitizer.
Okay.
Yeah. Because sometimes the family member, they have spent so much every month. Even buying gloves is expensive. So I would just carry a box of gloves with me.
Or they just overlook.
Yeah. Okay. Alcohol-based hand rub. Question: how many alcohol-based hand rub do we have? How many hand rubs do we have?
So many.
So many. Yeah. Hand rub. This one.
Sanitizer.
It's
Like how many
sanitizer.
times?
Gel.
Spray and gel.
Ionizer.
Ionizer.
Yeah.
Yeah.
So since after,
So
especially
many.
after COVID, the pharmaceutical company has developed different types. Some with fragrance, some without fragrance, some without alcohol, but it can have the antiseptic effect. So generally there are 2 types. This is gel type, and this is a liquid type. Yeah.
Hands-free, non-sticky.
Some says non-sticky, but some
Yeah.
even we have lotion type and with moisturizing effect.
Yeah.
For those who are sensitive to sanitizer. Yeah. And so far, any questions?
So where should I buy this one? This all, is it a pharmacist or?
Pharmacy, you can buy from pharmacy. You can buy from Guardian Watson, or even now supermarket they do sell. 99 Speedmart also sell.
Are there situations where one is better than the other? Like maybe for example, I've touched something, my hands are visibly dirty, I don't have access to water. Would the spray one be better than the gel one? Or
Effective.
Very good question, Anis. Sasha, what do you think? What Anis say is when her hands are contaminated with something visibly soiled, and she has
No access to water.
correct.
Okay, like for example, for me that situation that comes up is somehow always during sports or hiking or like dealing with pets and all that, you don't have access to water. I tend to use actually this one more than that one.
Gel.
The gel. I use more of this, but I don't know the right answer at all. But it's just this one, I think, because it kind of cleans the gel, it cleans the soil better for me than that, because it kind of doesn't take it away as well.
I would think the opposite.
You prefer gel.
What do you think?
For me, I would use a cloth or something to wipe off first. Then I use sanitizer.
Cloth, then
Because it's got
sanitizer.
soil, right? We can't straight away put sanitizer. It won't be
Very good.
effective.
Yeah.
So Atika said she used a cloth to wipe the soil
Yeah.
first,
Yeah.
then only use sanitizer.
Mm-hmm.
Shahrul, what do you think?
For me, which one available to me, I just use it.
Betul juga.
Which one and that at that time I have that I use it lah.
Okay.
Yeah.
To answer your question, number one, when it's soiled, visibly soiled, and then we cannot have access to water, what we do is, if you can, you have alcohol swab, swab it away. If you do not have an alcohol swab, use any tissue, any cloth to wipe it away, and then you sanitize. And you sanitize. After that, until you can access to water, you wash hand again. If you have tissue but no alcohol swab, spray the alcohol to the sanitizer to the tissue, and then you wipe. Then only you wipe it away. Then again you sanitize your hands.
Okay. Alright, thank you.
Yeah. Here. Again, we have two types: the liquid type, the gel type, and another one is lotion type. It's white in color. But I've tried that. Efficacy-wise, I don't feel it's so efficient.
Which one?
The moisturizer.
The lotion type.
Lotion one.
Yeah.
And it's kind of sticky after that. So you eventually have to wash.
Again, yeah.
Alcohol. To be safe, when you choose hand rub, make sure if your hand can take alcohol, can have contact with alcohol, get the ones with alcohol, 60% and above. 60%, 70% is fine. Not 90%. 90% is only used in the hospital setting to kill those, to sanitize away drug-resistant bacteria or virus. That one is too strong, it's not for us to use. Yeah, 70% is fine. Yeah, then it removes all the viruses, bacteria, and any germs compared to those without. Because some of these bacteria, they can cling on to the surface more secured compared to those if you don't use the one with alcohol. So in short, those with alcohols will be better. Even alcohol can reduce the surface area of MRSA. MRSA is a bacteria that is resistant to a lot of antibiotics, and it commonly happen in elderly. Even if someone who is mobile but elderly, can happen as well. You and me have it, we don't know. We have to do swab, especially at our folded areas. Okay. I would like to share with you how do we do hand rub. Okay. Two, three, four. Okay. This is a hand rub guide by the World Health Organization, WHO. Can you tell how many steps are there?
8.
8 steps.
Yes.
Yes, correct. So from WHO guideline to effectively perform a hand rub is 8 steps. Let me show you the first steps, then later you all show me back. Okay. Make sure when you dispense an amount, it's sufficient enough to cover both hands. Can all of you see?
Yes.
Okay. Accurate, roughly estimate is about 50 cent size. And then you rub 10 times. 1, 2, 3. That's why happy birthday to you. Roughly 10 times already. Happy birthday to you. That's why we did the energizer lah. So second step is the back of your hand. Remember, we always miss out all these areas. That's why you put your hands like that. Then repeat on the other hand. make sure you cover until the front. 10 times. Then front like that. Just now was first step was like that. Now it's like that. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Then all the fingers are red, right? Like this. Then switch like this. The 4 fingers. So now we have covered 4 fingers. What about thumb? Grab your thumb and rub. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Repeat on the other thumb. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then our fingernails. A lot of microorganisms are hiding under. So we do like this. 1, 2, 3. One circle is considered 1. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then repeat. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Yeah. And then leave it dry. If you have balance, can do like that. Question. If sometimes you dispense too much, it's wet, do you wipe it away?
I usually just wipe more things. Yeah, I gotta do more places, yeah.
Okay, we don't wipe it away. You put it like this. So if you think our hands, usually these are our scale fingers. Do we always in contact here? Yeah, not really. Yep, because this is usually we do things like that. In comparison, fingers and forearm, which one is more dirty? Yes, that's why 8 steps here. Subsequently, extra, you can circle, then swipe it off, then let it dry. It has alcohol, it will dry out very fast. Okay. Okay. Are you all clear with the steps?
Yes.
Can we all stand up and do one time?
Yes.
Who wants to use gel? Gel is here. This is hand wash. Who wants to use gel or you want
Spray.
spray? Okay. Try to spray on your hands.
This one. No, you said about 50 cent size, right?
Put on the both side?
One
Or
side.
just one side?
Make sure you like that. Don't like that. Then it will. Okay. Can.
50 cents.
Actually, I just realized why I prefer to use gel. I didn't realize until you asked the question.
Because
No, because I have to touch more of the bottle to hold. So that's why I tend to, like, my hand is dirty, I press with the thing. Like,
there are
if my
dispense
hand is
type
already
as well.
Yeah,
To go
but-
fast because I'm from there.
Okay,
It's dry.
alright, let's go. Okay.
Okay.
It's very clean.
Okay, you try. You try. You have to get used to it, the
Okay.
amount. Yeah?
Yeah.
First step.
Okay.
First step, you dispense already.
Yeah.
Second step. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Back of your hand open. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Like that. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. In front again. Here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Fingers. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Swap. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Thumb. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Swap. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Fingernails. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Swap. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then just dry it. Yes.
What was the last part of the song that Anis loves so much?
I blocked it.
Yeah,
Sorry.
okay.
Don't know what.
Hand rub is the best.
Okay. Okay.
Can we do one time without I'm showing?
Yeah.
Yeah.
Okay.
Okay. With the spray.
One
Yeah.
by one or together?
Together?
Together lah.
Together. I will watch.
I'll try that one.
Try this. Aduh, habis.
Okay, start. You can start first.
Okay, go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. No, this is not it. This is the bonus.
Just like
Henrab is
Jaya.
the best.
Yeah. Good job, everyone.
This one nice smell.
Yeah, smell.
Like
This-
this one sticky lah.
This contain a bit of fragrance.
And it's not so dry.
A bit of fragrance.
Yeah, but
Mild.
just-
I love this as well. I always use this.
Yeah, this one is a bit sticky.
Yeah.
Okay.
Baby.
So remember all these steps.
Feels so clean.
Next time when we scan the hand, then we know there are no raided
Yeah.
missed areas.
Clean.
Okay.
Okay. Any question on hand rub?
No.
Okay. Now we move on to hand wash. Hand wash, meaning you wash your hands under the water, and you need to fulfill the steps as well. Can someone read for me, please?
Soap and water is the recommended method when hands are visibly soiled. Plain soap is used for routine hand hygiene. Antimicrobial soap is used in acute care high-risk areas.
Thank you. Hand wash is used when it's visibly soiled. Like example, just now I said after a procedure, I've used a pair of gloves. After removal, it's not visibly soiled. Hence, I use this. I can use this. But when it's visibly soiled, then of course we must wash, provided we have water, right? And at home, we don't encourage much of alcohol base if there is not much of a patient at home. Just a normal soap, but make sure you use the right steps. And in the hospital, of course, we need to use the alcohol-based
Yeah.
hand wash or hand rub to remove any possible microorganism.
You said earlier that you not encourage the soap with the alcohol. You mean in
The
the house?
soap in the house.
Why? Why?
It's encouraged, but not the need until you need to buy an antimicrobial, because at home is usually a community base. We don't have at home not much of a MRSA, but it's good to have if you want.
Oh, okay.
Because sometimes people will get the skin irritated.
Some people like reactions lah.
Yeah. When I was working in the hospital, we always get eczema here and here. Too dry already. But we still had to put. So each time when we put the alcohol base hand rub, it's so painful because of the wound that we have. It's all cracked. Yeah. But we still have to do it.
So painful.
Then you have
Yes.
to like use lotion.
Yeah, that's when we start using the lotion. Still have to wash in the end. Because by a lot of washings and alcohol hand rub, we are removing the protective natural barrier from the skin, and hence it causes a lot of dryness lah. That's why again back to module 1, how do we protect the skin of the elderly? Is putting the moisturizer and then let it dry. Make sure not soaked. Next, we move on to hand wash. Again, two of you. Welcome. Hand wash.
Thank you.
Okay. This is also by WHO, the World Health Organization. Can you all see hand wash? How many steps are there?
11 steps.
When
11 steps. What are the difference?
rub with
Wet
towel.
hands with water.
Rinse hand and then rub with towel.
Use towel to turn off faucet.
Use
to
towel.
clean off that
Mm.
bit.
What are the similarity?
The
steps.
movements.
Movement.
Yeah, the same with hand rub.
Yeah.
The difference is
Just need to dry up
Dry
our hand.
Before switching off the faucet.
correct. So then we will practice again, pretending that there's a basin in front of us.
Mm-hmm.
For that,
Water sound.
oh my god, we need to talk more. Okay, let's do it one by one. I want to see. All right, 5 minutes for you all to go through. The difference for hand wash is at the beginning, there is a tap that you have to wet your hands. That is step 1, together with dispensing the soap. Subsequently, step 2 is the same, which is like this. And then step 3 is the back, and you switch. Step 4 is the front. Step 5, our skill fingers. And then you switch. Step 6, don't forget our thumb. And then we switch. Step 7, our nails. And then followed by step 8, rinse. Rinsing under water. That one is rub, it's the same. So you dry, but if you are using a hand wash, then you rinse under the water. As you rinse, imagine this is the flowing water. How do you usually rinse the soap away from your hands?
From here to the tips of my fingers.
From here. Sharu?
The area that has soap.
So you do like that under running
Until
water.
my hand under here.
Okay. Sasha?
Yeah, we do this, and then I kind of, I don't know, I scoop it a little this way under the sink, and the other
Okay,
way.
imagine this is the water.
Yeah, so after I do that, I wash my hands this way, and then I kind of do this. It's a wash. I don't know.
Wow.
I wash it. I'd like to wash it up to here, and then I.
Yeah.
Yeah, I don't know why I didn't. Yeah, I'm really realizing a lot of things that's weird about myself right now. Yeah, I don't know. I do that, and I do it this way, and then.
Okay, interesting. Move.
Yeah.
Atika?
Learn how.
Rinse.
Mm.
Rinse. I always do this lah.
Mm.
Circular motion.
Hmm.
That's it.
Okay, everyone has different ways. The right way is because you have washed all the tips until here. Imagine if you, here is clean, you wash already, you scrub already. Here is not your wash. So what happens if you the water running from here down here? You will contaminate lah. You will contaminate the front part because you are flushing the
The
dirty area to the clean area. This is clean, this is dirty. So when the water is running, it's encouraged that you point up like that. So it flow down like that. Then you wash, then don't like that. Cross contamination the right way. Especially before you do a procedure, this is very important. So when the water like that, you wash like that, then turn, clean the area, then let it flow, then only you flush the bottom. But make sure the water drip back to the basin. Then this is dry, then this one also you can do the same.
Tapi ambil semayang kita buat macam tu kan. Tapi bila lepas tangan different lah.
So your semayang is the same.
The
It's like
right
this.
way. It's
So
like
our
that,
hand
yeah.
like this.
Oh, see?
The way, yeah, but we
Here
don't
to
follow
here.
the
But
way.
when you wash your hands, I don't know why my first
We
instinct
do
is
it.
to
Yeah.
let the
Yeah, me
soap
too.
go off my hands, right? So if I were to put it this way,
That's normal instinct.
Yeah.
So from now, then you'll do like that.
Okay, but you see where I
Yeah.
soap, I still soap up to here.
Yeah. me
So
too.
that's why I'm doing that
Yeah.
because I actually soak up to here. So
Mm.
that I gotta get it somehow.
Yeah. It's actually, in a way, it's correct. Then that's why when in the hospital, you see after we wash and then we wipe with
Then the
sterile.
doctors will go around
Ah,
like
they will-
this.
Yes.
No wonder.
Because this is clean. Moving downwards is considered more dirty because we already scrub.
Yeah.
Our waist area above is considered clean because you already clean. Once you put down, consider contaminated. So you have to do all washing again. That one is for surgery. So now it's for procedure, we can practice some good habits as well. Then you dab dry. And this comes to number 10 when they say use the cloth, the tissue to close the forceps. I want to share with you because when I was attending as a care manager to a patient at home, I need to do a wound dressing to a ama, to a grandmother. Then at home we don't have like hospital tray, a wound dressing tray. Then in the hospital also the basin, the tap is long. So after we wash, we can just use our elbow like that, or that's a tap. You just tap, the water stop. So after I done all this, I need to be sterile. So my hand needs to be up. But the water tap is loose and it's those, you need to press down then turn.
Then how?
So what do? We have a sterile, I brought the sterile dressing set. Sterile dressing set means inside the set, it has pre-packed all the sterile gauze, the tissue, cotton, and some sterile plastic for you to throw rubbish. I went back to the set, I take the plastic, sterile, I'm sterile. So sterile touch, sterile is fine. So I take the plastic, I go back to the water tap, the faucet, then I close it. But this one I have to throw it because it's already dirty. I cannot pull back to the dressing set. Then I throw it, then I use again the sterile tissue to dry my hands already. I go back to the patient. But I do not have the plastic to throw rubbish. So what I did was, I used my feet, take another patient's plastic, those normal plastic that you get from supermarket, put on the floor, because if I bend down, it will get dirty again. So I do all the wound dressing, then the dirty stuff I just drop on top of the floor, but on top the plastic. After I've covered the wound, it's sterility all maintained. Then after that, only I pick up, then wash my hands. That's why now it is very good that WHO has incorporated this step. Previously, it's not included in the steps. Previously, hand wash also 7 steps only.
Then during
It's
that
all
egg,
post-pandemic changes.
Yes.
then during that egg step tu, when we want to open the tap, then with our hand also.
Or you just leave the tap running.
Leave the tap running.
I see.
Yes. We leave the... Basically, if you used to the steps already, it's very fast.
Or don't open the tap is true.
Or you can open, while you open that time, at the first step, you put tissue there. You use tissue, open, then leave it the tissue there. But it's still not so clean lah. But anyway, that one is sterility, is when you are doing a procedure. That is mostly in the hospital that you need to maintain. But it's good that you maintain this. Another way is you sanitize the handle, the faucet first before you perform your hand washing. Use this and spray.
Sometimes I just, before I wash my hands, I take the soap and I wash that thing first.
Correct, me
Yeah.
too. Yeah, because usually all these handles, doorknobs, switch, all these common shared items are highly contaminated. Yeah. banyak susah. Step by step, we master the skills of this. Okay. I want to see how you, every individual, demonstrate to me the steps. Then whether you can remember the steps correctly or not. Okay. Do you need time or you can start now? Can? Ready? Okay. Who wants to start first?
Referring to this or not?
Or
Without
hand rub.
referring.
Without.
Hand rub or hand wash?
Hand rub. Huh? Hand wash. Just now we did hand rub. Now it's hand wash. So hand wash we pretend only. There is a water.
Okay. Okay, sure.
Okay, come.
Here. Okay. So, run it under the water or take you.
Role play.
Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Oh, that's all. I forgot the top.
Yeah.
Okay.
Mm.
Okay. Wash it. Thank you. Take a tissue. Dry.
Yeah.
And then dry.
Okay, pass.
Fast.
Not
Not in
this
the right
one.
order.
It's fine.
It's supposed to be this one and this
Correct.
one, right? Okay.
It should be.
Is it still okay
That's
if we?
why people always get thumbs dirty.
Is it okay if we don't really follow the step but still use that?
Not in order.
Not in order. Is it okay or?
It's okay as long you do all the 10 steps and effectively. Like example, you make sure you betul-betul cover the inter finger space.
Okay.
Don't like that only.
Okay.
Then you're supposed
Yeah.
to put it all the way to the end, right?
Correct. Yeah.
Okay.
Cheryl, ready? Stand here lah. Show everyone.
Yeah, water.
Water tap
The
here.
lastnya water.
Washing. And then I take soap.
Toing toing.
Pang.
Mm.
Then 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The tap is running, so I wash and
Yes.
ready. And then I take tissue. I
Wipe your hand.
wipe my hand first, and then maybe it's already wet, and then I throw it away. Take another tissue to close the tap and get it.
Yes, pass. Next.
Hold on, wait, huh?
From the picture,
We come out
looks
as
like
again.
Like that.
ni buat macam tu.
Circular.
Oh, so
Come out or stand here? Boleh? Come out.
Come on. This is the come out the tap.
Oh, sorry.
Water tap is here.
My tab is sensors.
Yeah.
1, 2, 3, 4.
Whoa.
Yeah, so take. Shh. No, must take soap first. Okay, soap, then go. 1, 2, 2, 3, 4, 5, 6, 7, 8, 9, 10. Sorry, tadi you said must circular, right? Not like this. You have to go round even this one, right?
Like
Round.
Mm.
Yeah. 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then shh. No, okay, not. Wash and shh. And then they teach you like
Sound effects.
ta-da.
Yay! Atika!
Last but not least, water tap. Water. Pap, pap. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay dah, tissue, what? Through, take another tissue, off the tap.
Yes, Pam. Very good, everyone. Any questions so far?
So yeah, the order doesn't matter, but it's better this way. Is it because it's cross-contaminating another
No
way? or
cross-contamination because this is not a sterile
Yeah.
process,
Yeah.
but it's a clean process, meaning to make sure it's clean. Yeah,
Is it like this or like this?
like this.
This.
Mm.
Does it matter?
Yeah.
No, it does not. As long you cover your thumb and here.
Yeah. So this is a genuine, like my concern always. I always I have issue with the bathroom doorknob specifically. Okay.
Me too.
I really got a really
Me too,
terrible issue with it.
I also.
So some places, especially in Malaysia now, we're not really providing tissues everywhere. You gotta hand dry and all that stuff, right?
Mm.
But the bathroom door, some people don't. They just do that,
Yeah.
and then it's wet.
Yes.
So I get stuck in the bathroom. I've actually called people to come and push it from the other side because it's a it's a not a clean bathroom.
Oh.
So like I really don't want to touch it.
Mm.
Okay, so then there's no tissue, there's no this, there's no that. You waste your time washing your hands. How are you getting out?
You sanitizer?
Is it a round doorknob or press down?
Both? The door one even I still don't like to
Aku
geli.
jadi, I also same.
Yeah, I agree.
Especially public lah.
Yeah,
kan?
public bathroom lah. Home
I
house
also
bathroom
make
is
sure
okay.
you
I always use the.
Yeah, no, I do. Yeah.
Sanitizer
I
after
always
that.
have that problem, yeah.
Because at least you wash your hands already, all are clean.
Yeah.
You remember that 2 fingers or 3 fingers that you
Then you
use.
just come out and clean some more lah.
Mm.
Okay, yeah. Because
Spray, then you clean. The 7 steps again.
Sometimes he also. When I
Yeah.
kena, alamak. Who can help me sometimes?
So you can use tissue.
Tissue, yeah.
I
always
also
bring.
use tissue from the toilet.
What I see most of the mall life, nowadays they didn't provide tissue but they provide the
hand.
but
The
that one
dryer.
put ke bawah,
Mm.
push to the bottom kan.
Yeah.
That thing has a lot of germs, right?
yeah.
Did you peep in at the base? What is that?
Can't see, no?
Some you can see the
Yeah, those that with 2 holes for your hand and then like that at the bottom.
Yeah.
I do not see.
Try to see. I see already. I don't want to use.
Yeah.
Oh, is it?
I never use.
So it's not hygiene lah.
No, the best is white.
But the Dyson one, some shopping malls that installed the Dyson hand dryer, they have this nanotechnology which filter away
Yeah.
any microorganism to go in to the dryer, so it does not blow towards your hand. That one I use. Because after that, it has nothing at the bottom. It's just two blower. You put your hand, then you blow like that. Then it has a filter to filter away microorganisms, small particles. The older version is not Dyson. I don't know what brand. That one, because it circulates there. Yeah.
How to save the planet, right? It's that.
Yeah, like how? But nowadays so many microorganisms. Last time we don't have hand dryer. We do not have COVID. We do not have SARS.
Right.
People live like that.
Still covered.
With all these mutation of the viruses, it's cause more problems with us. Any other questions?
No.
So far so good.
Okay. So now we have come to the end of module 3. By now you all have learned how to
Perform hand hygiene effectively.
Perform hand hygiene effectively.
Hand wash, hand rub, the different steps.
Oh yeah, that is good. How many steps of hand rub?
Hand rub.
Steps.
8.
Hand wash?
11 steps.
Correct. And you all have already mastered the skills of all the steps. Yeah. And then from module 1, we have learned to be
Role of a caregiver.
yes. And what is the learning outcome?
Able to list the role of a caregiver.
And what is the purpose of being a role of a caregiver?
Provide support and assistance to individuals who need help due to old age, illness, disability, or other factors.
Thank you, Sharul. That is from module 1.
Module 1.
Module 2, what have we learned?
How to communicate
Effective
effectively.
communication.
Yes. And what is the learning outcome of effective communication?
To
Implement
implement
effective communication methods with patient at home.
Yeah.
And the purpose of it?
Build strong work relationships with co-worker, patient, and patient family.
Yes. And lastly, module 3, hand hygiene. What is the learning outcome of it?
Able to apply hand hygiene techniques efficiently.
And the purpose?
Crucial to maintain health, prevent the spread of infection, and prevent contamination of patient environment.
Yes. And how many moments we have for hand hygiene?
Hand hygiene. Sorry.
How many moments?
Oh, 5.
Five moments to perform hand hygiene.
Yeah.
Alright. Very good. By now, you all are able to?
Perform as a skillful caregiver.
Yes. I wish you all very the best in your caregiving journey. Yeah. And before we leave, I would like to have some pop quiz for your post assessment. Make sure you have a piece of paper with you.
Pop quiz, is it?
Pop quiz, yes.
Okay. Okay.
Kertas.
Ada. You want
Nah.
some?
Thank
Yeah.
you.
Yeah.
Okay.
Okay. Is everyone ready?
Yes.
Okay. Question 1. Which method of hand hygiene do you prefer?
Hand wash or hand rub?
Which one? Okay. So can you show your answer? Hand wash. Sharul? Hand rub. Hand wash, soap and water. Hand wash. So everyone except Sharul. Sharul, you have to carry more hand rub with you. Then you have to decide whether it's liquid type or gel type. And you have to test whether, are you allergic to alcohol?
No.
Your skin? Then that's fine. You can buy those small ones and hang on your back.
Okay.
Yeah. Question 2, ready?
Yes.
How many steps of hand rub by WHO? Maybe. Show your answer together. 8. Correct.
Yeah.
Question number 3. What is the role of a caregiver? The purpose of a caregiver. The purpose of a caregiver, imagine the water role play.
Support, yeah.
My writing is so bad. Gosh, shocking. Not gonna judge me for my writing, right? Okay.
No. Hmm? Done. Wait. Oh well. Still writing.
Oh my gosh, isn't it?
A plus student.
Suddenly got dementia.
Done. Okay. In 3, 2, 1, up.
Read.
Provide support and assistance. Give support, assistance.
Gosh.
Provide efficient and thoughtful care. Communication effectively correct. And provide support and care in ADL. Correct, everyone. And our last question. Get ready. Is listening skills important when you are communicating with an elderly? Yes. 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 Okay. Exactly. All of you agreed. And please apply what we have learned today. After this, you can start trying all the equipments we have here. You can ask me any question if you have while trying those, and sign up to our upcoming workshops.
When?
Thank you for your... When is it? The next one is another 2 weeks.
2 weeks.
Mm.
Alright.
On fall at home. What do you do when there is a fall at home?
Okay.
So preventing a fall.
Yes. And then in another 4 weeks time, we have another one is basic life support. It's basically when there is a choking, what do you do? And when it's an unconscious person, what do you do? Yeah. Are you interested to sign up?
Yeah, for sure.
Okay, I'll get my staff to communicate with you on this. It's good to know all this. All right. And here is a assessment form for your feedback. Please write your full name and provide your feedback.
What's the title again?
Caregiving skills at home.
Oh. The title is here.
Caregiving skills.
Caregiving. ING. V-I-N-G. okay. Yeah.
Sign both.
It's okay. Oh, thank you. Thank you for your time today.
Change my name for this call.
Sherry.
Change this call.
Make the course longer.
Thank you so much.
Thank you. Thank you for your time today. You all can move about.